think it's a nice contrasting. Yeah. Hello, Dr. Shambhavi. Welcome. Congratulations. It must be a great feeling to
Thank you
be
so much.
one of the top 10 candidates in the NEET SS 2025.
It is a very it's a very different feeling which is I cannot describe.
So, it's a great feeling for us as well as faculty when we see our, students, our trainees who are doing well and going ahead and achieving their dreams. That is what we do all this for. Much apart from, it's the joy of teaching, and the same way I think the joy of learning should be yours, and that is what we want you and help you achieve your dreams, of course. So tell us a little bit about yourself, Dr. Shambhavi.
I did my MS in General Surgery from CHGS Medical College and KM Hospital, Mumbai. Following which I was doing my SRship. I did 2 months of SRship in the Department of Surgical Gastroenterology in KM Hospital itself, followed by my bond-related SRship in General Surgery. Then I appeared for my exams. This was my first attempt at NEET SS.
Oh, that's really great then. So, it's a little different from most other journeys that we see. Most people either give it in
Yes,
their first attempt, and a lot of people have
yes,
actually gotten into INASS this year, and also some in NEET SS, they've all gotten in their first attempt. It is also again your first attempt, but you have actually taken a 1 year break and you wanted to
yes,
do more in surgery, and then that's probably the first candidate I'm hearing who has done this. But it's good in some ways, you are getting yourself, letting you find your feet in surgery,
yes.
making yourself confident, and then you're doing it. So that gives a level of maturity. That's great. So your undergraduation was also at CGS, doctor?
No, sir. My undergraduation is from Mahatma Gandhi Institute of Medical Sciences, Sevagram, Bardha.
So tell us a little bit about your preparation and how you went about in this 1 year. I'm sure you must have been preparing hard. You decided that you're not going to give it last year, but then in this 1 year you have made it count. So how did you do it?
One thing that I would like to say is that particularly for the NEET SS perspective, my preparation was limited to only my SRship duration. During my residency per se, I did not prepare for the exam specifically from the competitive point of view. But I was very thorough with two things. One is consistency in my clinical work, which I think is the most important. That you have to be present in the wards, you have to see your patients on a regular basis. They will teach you the most. And secondly, to read from the standard textbooks from the very basics. I did have a doctoral subscription even back then. I used it to supplement my studies, but I was since I was not going to appear in the first attempt, so I was not very competition focused at that time. But I think I used it to enhance my knowledge base at that point of time during my residency. So I ensured that during my residency, at least at the end of it, I have a good foundation on which I can build for my preparation for competition or for my practice later on. Thereafter, during my SRship, I focused more on the competition phase, which is practicing MCQs and giving the grand tests. And thereafter, to polish whatever I think I could not have done to that greater depth during my residency. So the polishing part and the exam focus part I did in my SRship, and the foundation part I built in my residency.
So, digressing a little bit, do you think the doctoral subscription helped you during your residency for your
It
day-to-day,
did.
handling of
It did.
patients, for reading
Yes,
the basics
it did.
and all
It did.
that? That is what I've
Because
been telling you. Yeah, yeah, please go ahead.
because the doc tutorials modules were so beautifully arranged that they would help me streamline my thoughts, and all the content was condensed into what is clinically relevant and also what I can apply onto my patients. So if I wanted to study for a particular system, for a particular patient, for a particular condition, or some patient that I have encountered, so even if I don't have time in my hectic residency and rounds and OTs, just if I go through that doc tutorials modules, even if I don't have the time to sit down and write it down, even if I hear it, I knew that I am learning, I am getting the crux of the matter in a very concise manner, which I know I can apply. And that has definitely enhanced my learning in residency. Of course, the competition part remains, but to help in residency day-to-day work is also, I think, Dr. Tutorials has done a fantastic job in preparing the modules in that comprehensive manner.
So all of us as faculty at doctorals are also practicing in various fields, and I think that shows most of us are doing this more out of passion for teaching students and
Yes,
imparting the knowledge and imparting the clinical base as well. At least I do it, and I'm sure Dr. Mahendran, Rajmendran, I have seen him do, and same way with Dr. Venkatesh. All of us tend to use these examples and clinical scenarios that we come across on a day-to-day basis, and you are absolutely right in saying that your clinical work, the patients are going to be your best teachers, and that will stay with you for a very long time. You see one patient with a complication or with a finding,
yes,
you'll never
yes,
forget it. Just
yes,
reading from the book
definitely.
is good, but this will supplement your knowledge. And so since you've done your residency with doctor tutorials and then you took up the core competitive part of it, so
Hmm.
can we say that it put a base and then this was enhancement that happened with the 1 year of intense
Yes.
preparation?
Yes, yes. So, with the theory base already built, I could move on during my residency. So, a huge chunk of the tutorials videos part I had already covered during my residency. So, I knew that my theory part was more or less covered, and supplementing it with textbooks or with my clinical work. So, my foundation at that was built. Now, in my SRship, when I did, then I went more into the MCQs part and solving MCQs, and the MCQ modules in doc tutorials, firstly, the question bank is extensive, which I really appreciate. There are, even in the subtopics, each and every topic is covered. Every topic has MCQs which look at the same problem from different perspectives. So you know that even if you're thinking of or studying a single topic, that topic is covered from all respects and you're not missing out on any aspect of it or any possible MCQs. So that is why the question bank, which was this extensive, plus the smaller tests which were there, the grand tests which are included. So all of that just added value to whatever text or videos which I had already seen, and thus it just gave that extra edge or push, which helped me to push my rank further, despite this being my actual first attempt. So definitely, and the question banks are also organized in a very meticulous manner. The division of the modules is very helpful, so that I can. And one thing that I would like to point out, that I would also use my doc tutorials notes, which I had prepared during my studying phase, and doc tutorials MCQs both. So for both of them, I was depending upon this platform. So what I would do is I would do a discordant revision during my SRship, so that I'm revising a theory from one topic and doing MCQs from another topic, so that at least I don't have that bias that
So
if I've revised this, then I'm able to do the MCQs. So I did not want that bias to creep in. And since the MCQs were beautifully divided and in modules, so I could do it even on the go, like when I'm waiting for something, or when I'm free for some time between rounds or something. So all those times I could utilize. So despite the fact that I was working throughout, I knew that my time was not getting wasted in terms of the competition preparation. So for that, I thank the team for making a comprehensive module which is designed in a manner which can be utilized even with work.
that's great. Like, what you're saying works in the sense that you form a base and then you build on it. That is the way, and consistency is the key. Your
Yes,
preparation shows that essentially consistency is the key. And since you have been having it at least for the last couple of years in your residency or for your entire residency, you can take it at a slow pace and slowly work on the modules and everything. And even though you may get new editions of books, the base remains. It's not going to change
yes,
drastically. It's going to be, I mean, even in the editions with 28th edition in Bailey or the 22nd edition in Substance, we find almost like 70-80% at least is the same. It's hardly 20% that changes with the next edition. So,
hmm,
irrespective of which edition you're following, it's still going to be laying the groundwork for you to learn. And once you do the intense phase of preparation, I think that helps away. And getting rank seven is my favorite number in so many senses, and it's great. It's great. You're in the top 10. And so, what would you like to do further? Like, have you thought about what you're interested in? Or
I am interested in surgical oncology. It is a complete matter of coincidence that I am having my interview with you, sir. But
okay,
surgical oncology has been of my interest always. Uh,
great.
so, because I think it makes a difference. Secondly, I would like to further be in a branch which makes, as I said, it makes a difference. So.
Yeah,
That,
most of
that,
the
that is
top
something which
100, 200 candidates usually choose either gastro or onco. These are the top two specialties, with a
yes,
few choosing urology. So I'm happy that I could take your interview. As you said, it's completely a matter of chance. All of us take, whichever person is available, that faculty will take
yes,
the
yes,
interview. So I'm glad that I could take your interview. So anyway, you're going to take a dream, course. The entire thing is
yes,
open for you. Like even if the first six
yes,
candidates are going to take up Tata, still you have Tata open for you. And
yes,
you are getting it in Tata. You're going to take TMH or you're planning in some other
yes,
place.
yes. That
TMH. Oh, okay. So TMH is a great place. It's practically the mecca of surgical oncology as far as
mm,
India is concerned. So great training. So any special sort of gratitude messages that you want to pass on at this point of time to anybody? Let it be particular faculty in doctortorials, your family, your friends, your seniors, colleagues, anybody.
uh,
You can use
so
this
for
time.
multiple people I owe this success to. Firstly, my family. My parents have always been there, but also, actually, I got married barely 1.5 months prior to the exam, and I have had immensely supportive in-laws and my husband, because of whom I have been able to achieve this. Because to get married barely 1.5 months prior to the exam, and the break in the momentum which happens with events happening, despite that, I was able to pull through. I owe everything to them at this point. Then, of course, my institute, which has trained me for 3 years. My I was at KM Hospital. I'm glad that I was there, because I think the variety of patients that I have seen to be guided by the best of faculty members. So a lot of things I could answer from memory of some patient, or of having seen a case, which did not require me to actually refer back to some theory book or textbook or reference. Just by the sheer patient load that we manage, we are able to answer. Then, of course, Dr. Tutorial's team, because as I said, it has been with me since my residency, even before I took the decision of whether I want to do super specialty at all in the first place or not. So just because I used it as a learning tool first and as a tool for competitive exams next, I think it has contributed in a huge way, not only for this rank for an exam, but also to how I think as a surgeon today when I see a patient standing in a bedside. So that foundation, building that foundation, and then taking it a level higher to translating it into a rank in a competitive exam to achieve both those goals simultaneously. I think Dr. Tutorials has played a fundamental role in whatever I have been able to achieve. So for that, definitely, I would recommend it to all my juniors. And this platform was recommended to me by my seniors, and I would like to pass it on to the next batches as well.
That's great. I feel really glad. And again, hats off to you, because having a marriage about a month and a half ago and then scoring rank 7 is no easy play. It's a great job that you've done. And but I'll just point out to say that it's your consistency. You've been working on it essentially since your residency, and that when you have a slow sort of like graded preparation and you focus on the basics and the concepts, then it becomes easy for you to get through the exams, whatever it may be. And I'm sure that top tutorials, as you mentioned, would have been helpful to you even in your examinations for your MS, for your final exams in
Yes,
MS.
yes, yes,
Getting through
yes,
cases, answering questions, everything would have been pretty easy. So we as faculty can make out a difference when we are discussing some patients and points and everything. We know the difference now that you're keeping up to date, because we have to teach you, we have to be up to date. So that makes a lot of
yes,
difference to us. So I wish we had something similar during our training days. And
yes,
you are emphasizing the same point. So it's residency itself can be a training period and a learning period, irrespective of whether you choose to
mm,
take your CH or DNB exams. It can still be a learning tool during your MS, and that is what your journey has actually shown us. So congrats once more, Dr. Shambhavi, and wishing you well and all success. As always, these
thank you.
materials, and probably we'll be able to give you the Dr. Tutorials INASS subscription as well. We'll be able to provide it for use during your MCH. And that will,
Oh,
because at Tata, the work is going to be pretty tough. You may not really find time to go through the actual text, Devita, and all that. So
mm,
we'll be glad to provide you with the subscription purely on an honorary basis, because you have been one of the toppers. So we'll be glad to do that. And again,
thank you.
you have our numbers, and please feel free to contact in any case of help
Yes,
in
sir.
either a professional sense or with the help in papers or something like that. So all the best, and wishing you all success in life as well.
Thank you.
Thank you.
Thank you
Thank
so
you
much.
again for
It
joining
has
for
been
this
an
interview.
honor to have my interview with you. Thank you so much.
Thank you.